Welcome to my channel. Today in this video, I would like to address a very important topic for those who suffer from or live with someone who has atrial fibrillation, also called AF or Afib. AF is a common cardiac arrhythmia, but it can generate many doubts and concerns. That's why in this video, I've selected the 7 most frequent doubts about atrial fibrillation and I'll try to clarify each one of them. I hope this content is useful for you and that we can learn together about this condition that is so important for cardiovascular health. So, let's get started. What is atrial fibrillation? Atrial fibrillation, also known as AF, is the most common of the cardiac rhythm disturbances. This condition significantly increases the risk of stroke, heart attack, and other serious complications. When a person has AF, the electrical signals that control the heartbeats become abnormal. This causes a decrease in the effectiveness of the heart's 2 upper chambers, the atria, which stop pumping blood properly. As a result, a small amount of blood can accumulate in these atria, forming clots that can migrate to the brain and cause a stroke. AF can occur continuously, being called persistent or permanent, or it can be intermittent, being called paroxysmal. If you have had 1 or more episodes of AF, but now have a normal heart rhythm, it is important to ask your doctor what to do to keep it under control. Some measures can reduce your chances of new episodes of AF, such as controlling blood pressure, avoiding excessive alcohol consumption, with a limit of 1 to 2 drinks per day, reducing caffeine intake, treating possible thyroid problems, and practicing regular exercise. What are the symptoms of AF? Atrial fibrillation, a common heart condition, can present a variety of symptoms, but it can also occur asymptomatic. When symptoms are present, people with AF may feel as if their heart is racing, skipping beats, or beating out of sync. These symptoms can be accompanied by mild chest tightness or pain, dizziness, and difficulty breathing, especially during exercise. In addition to these symptoms, some people may also experience fatigue, weakness, or even fainting. The feeling of shortness of breath or excessive fatigue may indicate that the heart is not pumping enough blood to meet the body's needs. Fainting may occur when temporary lack of oxygen in the brain, which is still concerning. If you experience any of these symptoms or suspect that you may have atrial fibrillation, it is important to consult a doctor immediately. AF can significantly increase the risk of serious complications such as stroke and heart attack. Proper treatment can help reduce this risk as well as improve symptoms and quality of life. Is there any test for AF? Besides the electrocardiogram or ECG, there are other testing options that can help diagnose atrial fibrillation. These include Holter monitoring and event monitoring. Holter monitoring is a test that involves the use of a portable device that continuously records the electrical activity of the heart for 24 to 48 hours or more. This can help identify intermittent episodes of AF that would not be detected by a short-duration ECG. Event monitoring is a test that involves the use of a portable device that records the electrical activity of the heart only when symptoms occur. This device is usually used for a longer period than the Holter, such as 2 weeks to a month, and can help diagnose paroxysmal AF. In addition to these tests, your doctor may also recommend other exams to assess the health of your heart, such as an echocardiogram. It is important to remember that early diagnosis of AF is essential to prevent serious complications, so if you suspect you may have the condition, it is important to seek medical evaluation and guidance. How is AF treated? There are several treatment options available for atrial fibrillation, and the type of treatment chosen will depend on the severity and duration of the condition, as well as other individual health factors. Medications are often used to control heart rate or rhythm in people with AF. Rate control medications help decrease heart rate and improve blood circulation. Rhythm control medications, known as antiarrhythmics, help maintain a normal and regular heart rhythm. Anticoagulant medications are also used to prevent the formation of blood clots, reducing the risk of strokes and other complications. In some cases, cardioversion may be performed to restore normal heart rhythm. This treatment involves applying an electric shock to the heart under sedation to interrupt the AF and restore normal heart rhythm. Another treatment option is ablation, which can be performed using either heat energy, known as radiofrequency ablation, or cold energy, known as cryoablation, to destroy small areas of the heart that are causing the abnormal electrical signals responsible for AF. This procedure is performed through a catheter inserted through a vein in the leg and guided to the heart. In more severe or advanced cases of AF, a device called a pacemaker may be implanted in the body. This device is capable of sending electrical signals to the heart to control heart rhythm and keep the heart functioning properly. It is important to remember that the treatment of AF should be individualized and discussed with a specialist doctor who can evaluate the clinical situation and indicate the most appropriate treatment for each patient. In addition, adopting a healthy lifestyle with a balanced diet, regular physical activity, and control of risk factors such as high blood pressure and diabetes can also help prevent the occurrence and progression of atrial fibrillation. What will be my quality of life? Many people with AF are able to live normal lives. Nevertheless, it is important that you take the medications that your doctor prescribes every day. By taking the medications correctly, you can help reduce the chances that your arrhythmia could cause a stroke. In addition, some people with AF may have symptoms that affect their quality of life. These symptoms may include fatigue, shortness of breath, and dizziness. If you are experiencing symptoms that affect your ability to carry out your daily activities, it is important that you talk to your doctor. They can help you find ways to manage your symptoms. Maintaining a healthy lifestyle can also help improve your quality of life with AF. This can include regular exercise, eating a healthy and balanced diet, reducing alcohol consumption, and quitting smoking. In addition, it is important that you remain alert to warning signs of a possible stroke, such as weakness or numbness on one side of the body, difficulty speaking, or blurred vision. Although having AF can be a challenge, many people with this condition lead active and healthy lives. With proper treatment and a healthy lifestyle, you can help manage your condition and improve your quality of life. Why do I need medication? If you have been diagnosed with atrial fibrillation, the use of medication may be necessary to help prevent serious complications such as stroke and heart failure. Medications can help control the speed and rhythm of your heartbeat as well as prevent the formation of blood clots. The medications you will need to take depend on the type and severity of your AF. Some people may need to take medications to control the heart rhythm, while others only need medications to control the heart rate. Anticoagulants may also be prescribed to help prevent the formation of blood clots that can lead to a stroke. It is important to remember that while medications can help control atrial fibrillation, they do not cure the condition. You will still need to regularly monitor your condition with medical exams and follow your doctor's recommendations to help maintain your heart health. What medications might I need? There are three main types of medications used to treat atrial fibrillation. Medications to control heart rate. These medications include beta blockers like metoprolol and carvedilol. They work to reduce heart rate. Medications to control heart rhythm. These medications include amiodarone and propafenone. They help restore and maintain normal heart rhythm. Anticoagulant medications. These medications help prevent blood clots from forming. The oldest and most commonly used anticoagulant is warfarin. If you take warfarin, you need to have regular blood tests to monitor the medication's effects on your body. However, there are new anticoagulant medications available that do not require regular blood tests and are equally effective. Sometimes it may be necessary to try several different medications to find the one that works best for you. If you experience unpleasant side effects or have difficulty paying for the medications, talk to your doctor. There are ways to deal with these problems, and the first step is always to inform your doctor. And we've reached the end of this video about the 7 frequently asked questions about atrial fibrillation. I hope you enjoyed it and learned a lot from the information I shared here. It's important to remember that atrial fibrillation is a serious condition and should be monitored by a healthcare professional. If you have any questions or suspect that you may have AF, don't hesitate to seek medical attention. Also, remember the importance of adopting healthy habits to prevent the onset of heart problems. If you liked the video, please leave a like and share it with anyone who may benefit from this information. Thank you very much for watching, and until next time.